But thank you for your patience and welcome to the Alliance Spring Group meeting, the information session. We are so glad to have you here today. My name is Jen Dill and I chair the Alliance CRP committee. And I just want to take a moment to say thank you to the CRP committee for all of their really hard, awesome work building great content and breakout sessions and education opportunities for all of you. I'm really, really proud of the work they've done. At the end of this next week, you guys will receive a survey and, asking how the meeting went, all that kind of stuff. There's going to be an opportunity for free text comments. So I would ask that you guys please be specific and give really that feedback. What do you want to see? What would be helpful? And go ahead and share that in those surveys. The CRP committee will review all comments thoroughly, and we use that information to, to plan our future meetings. Caitlin, do you mind closing the doors? Thank you. Let's see if I can advance slides. Never stops. It did. Okay. Oh, but now how do I go back? What was on that slide? Did anybody see it real quick? No, then there was another one. Oh, no, you know what? It was like the silence your phones. Speak up. So guys, this is a great opportunity. We have content experts. Please go ahead and ask your questions. If you have them, certainly other people have them as well. So use your time to ask the questions you have. The CRP information session is worth 2 continuing education credits for SOCRA and ACRP. You will receive an email next week with a survey. You have to complete the survey to receive your credits. If you have any issues, contact Matt Corso, and here's his email address at Alliance. Just reminding you of some of the other sessions. After this is the iCare data session. So if that is
we cannot hear you.
You're muted.
Can you hear me now?
Yes.
Yes.
Yeah.
Thank you for speaking up. So look at the schedules. You are able to attend meetings you did not originally register for if you're in person. If you're virtual, you can still add them to your session, and you can attend any session unless it says it's a closed session, then that means it's by invitation only. Otherwise, you're welcome to attend any session that you see of interest to you. The CRP specific sessions we have are from 8 to 10 a.m. We have an education session. In the afternoon, we have our 3 breakout sessions that the CRP committee has worked extremely hard on. So we have from 2 to 3, the regulatory 201. So this is a more advanced regulatory breakout session from what we did last fall. From 3 to 4, Dr. Linda Sutton is going to give, it's cancer. Let's start at the beginning. So it's kind of the Cancer Basics 101, which is really fantastic. So I encourage you guys to attend that as well. Also, there are it's good to hear even if you are not brand new to oncology. And then from 4 to 5, we have a breakout session on SAE reporting and writing the CTEPIDER's reports. So those are the CRP specific sessions. Slides will be available on the Alliance website. And then I really want to introduce a new subcommittee of the CRP committee that has been developed since the last group meeting. And so I'm going to ask if you're on the protocol subcommittee and you're here, please stand. We have Alex Larson from Essentia Health, Carly Bai from Essentia Health, Howie Weiner from University of Chicago, Caitlin Shulka who's here from Wisconsin NCORE, Peggy Graham. Peggy's here, stand please, from Iowa Wide NCORE, Shanta Salzer. Shanta, I saw her earlier, not here, okay. and Trupti Hadiangadi from Heartland Encore. And so this is a new CRP subcommittee that we're adding to really strengthen the CRP feedback and review of protocols before a protocol is activated. This committee, I do plan to expand in the next 6 to 10 months. And so if this is something you are interested in participating in, please look for that announcement to come out in the next, hopefully 6 months, 10, if sometimes things go a little not as planned, but we're really trying to finalize all of our processes before expanding that group. But and then I'm really pleased to introduce Sandy Feinstone, who is a patient advocate, who has agreed to talk with us a little bit about why patient-reported outcomes are so important from the patient perspective. So please join me in welcoming Sandy Feinstone.
So I'm having the same problem that I had with the washroom in my room. I can't see the mirror unless I put my heels on. Obviously built by a man. I just. So patient-reported outcomes. I want to tell you that I went to a reliable research source to work on my slides, Google. And if you put in pros, trust me, you do not get patient-reported outcomes at the top of your research engine. So you might be a little bit careful if you go to the same source that I did. But the future of health information technology, integrated electronic medical records, and oncology care is changing, as you all know, at a very rapid pace, certainly from a patient perspective and from a patient advocate perspective, is very encouraging. I myself am a 30-year breast cancer survivor. I was diagnosed in the dark ages of breast cancer when there was no choices. I tell patients nowadays, the good news is you have choices. The bad news is you have choices because patients don't know how to make those choices. And some information that they get, unfortunately, is biased by the giver. But I would say to you that it's vital that information from patients are included in the health information that's collected. It will help you, it will help patients, it'll help the future. So to capture the patient perspective, it is essential that patients are involved, not only in providing information about their experience, but to be objective about the information that is gathered and the format that is being gathered in. PROs are now part of almost all clinical trial protocols that I am asked to review. However, the degree of information and the depth of information that's collected is from here to here, and you probably are familiar with it. Some patients receive surveys, pages and pages and pages of surveys that they are asked to fill out prior to their treatment, and pages and pages and pages of surveys that they are asked to fill out after their treatment, none of which are done. Patients don't fill them out. They may be very encouraged at the beginning, but they get very discouraged as it goes on. So I believe it's very important. Patient information is important to improve not only patient care, but as in the title, patient outcomes. I did go to a good source. I went to a recent PubMed review on patient-reported outcomes that involved PRO development. And it said it's essential to development, centered patient-reported outcome measures, but patients are not always included. It also said that when patients are involved, their level of involvement varies considerably. So you may see a report on patient-reported outcomes that has very little information in it from patients. That's where we are right now, unfortunately. I'm sorry.
No.
So I would suggest to you that future attention is needed to build and disseminate consensus on requirements for patient involvement. What does it look like? Because right now it's all over the map. Some people are very diligent about getting good information, and some people are just good about checking the box that they have patient-reported outcomes in their protocols. So the Medline report that I'm talking to you about is from 1976. Some of you probably weren't even born then, to 2004, that evaluated the impact of the PROs in routine practice. So the feedback of patient-reported outcomes results in healthcare providers appears to have substantial impact in some reviews and not in others. It seems particularly helpful on the diagnosis of mental health conditions. It didn't give a reason for that. It just showed that clinicians are paying attention to it within that realm of treatment. However, the impact on patient health status is much less consistent. Most of the published studies evaluating PROs as a one-off screening technology and measured only provider behavior, not patient experiences. Pattern of results from this Medline study suggest that a general lack of clarity is evident in this field. I will tell you that as a patient advocate, we worked very, very hard to get all of you in the clinical arena to pay attention to what patients had to say. So we're thrilled that it's included, but now we're going to push hard again to make sure that the data that's collected is good data so that it does help patients and it does help clinicians. So we need clarity in regard to the appropriate goals of the PROs and the mechanisms in which we might achieve them, and to fully evaluate the role in routine practice, and to measure impacts related to patient-provider relationships and patient contributions on their well-being. Okay, good. So what are the benefits to patients' reported outcomes? It gives patients a voice. Patients usually don't have a voice when it comes to their care. They sometimes have information, but very often when they go to their clinicians, when they've been diagnosed, they're told where to go, what to do, and what's going to happen. We need to change that. We need to change so that the patient care is improved. We need the patient-reported outcomes have a potential to reduce barriers in reporting side effects. You may or may not realize, but patients want to be good patients. They don't want to be perceived by their clinicians as bad patients. They want to be compliant. They want to be good because they believe that if the physician sees them as good patients, they're going to get better care. I'm not sure that's true, but that's sort of the perception out there. Patient-reported outcomes can help clarify the uncertainty of treatment. Not every clinician is going to be able to tell the patient what their outcome is going to be, but they can give you they can give them a broad perspective, all the patients that went before that received that treatment and what their outcomes are. From my perspective, the most important thing is it can stimulate conversations between doctors and patients. I was just in a previous session talking about clinical trials and how patients are randomized. And I asked a question that was kind of a prickly question that no one wanted me to ask, but I think that's my job. And my question is, why do patients have to be randomized? Well, that's the way it's always done. The way that things are always done is not always the best for a patient. If there's a choice and patients make a choice, why can't they do that so they can decide what arm they're going to be in? The answer that I received was, well, then there's bias. Well, trust me, there's bias when the clinician that's talking to the patient is trying to talk them into which arm they want them to go into. So again, I'm going to ask prickly questions, and I and other patient advocates are going to continue to ask prickly questions, hopefully in a respectful way that will cause thought and not agitation. It's going to, patient-reported outcomes provides a format to report things timely. Not when the patient has come in for their appointment with the doctor and they have a very limited amount of time. Those of you that have gone to the doctor know the doctor is always rushed, very often late. The patient doesn't have an opportunity to ask the questions. But in this kind of a format, and now with technology the way it is, there's no reason that patients can't get their questions asked. I live in Southern California, but I belong to a healthcare system that is extremely interactive with their patients. I can email my doctor any day, anytime, as many times as I want. I won't, but I could. And that doctor gets back to me in a timely way. And I will tell you, my relationship with my doctor is such that he'll suggest something to me and I'll say, I don't really want to do that. And he'll say, are you sure? And I say, do I look like I'm sure? And he'll say, okay, we'll talk about it next time. And we will. And I may change my answer next time. But I consider myself an educated patient and I consider myself knowing my own body better. He's getting to know my body better because I insist that he does. But we have that kind of a relationship. If I have an issue, I can email him. If I have a question, I can email him. And I think with the electronic record information and the way that patients and clinicians can correspond today, that should increase. I think it also gives the opportunity to manage side effects better. If I'm a patient on chemotherapy and it's my second day of treatment and I'm nauseous, it's not going to help my doctor or my team to know that I was nauseous on the second day when I don't get to talk to them till the 14th day. Those side effects need to be talked about and information given. And again, as I'm trying to enforce, the patient do not want to be perceived as a complaining patient, but we do want to be conceived as part of the team. That may seem foreign to you, but I want you to think about it a little bit. Who better to be part of the team than the patient? I'm probably going to run over, but I do want to tell you a little story. My husband was on dialysis for 4 years, and we met with our team once a month. The team consisted of the nephrologist, the nurse that treated him, the pharmacist, the nutritionist, and a social worker, and my husband and myself, me being the caregiver. We talked about everything. The team talked about everything. The doctor knew, and the nutritionist knew what she was going to tell him that he should eat every meeting. And she knew darn well what he was going to eat every meeting, which wasn't the same thing. But the conversation happened all the time. The nephrologist would say, you've got to exercise. You really have to exercise. I can give you the medication. I can do this, but you've got to exercise. And my husband would say, I'm going to try. And the doctor would say, you can't try, you have to do it. And he'd say, okay, okay. But everybody in the room knew he wasn't going to exercise. Did the conversation still take place? Yes, it was part of the team process. Did he try a little bit? He did. But it's important that that conversation to take place because we felt very much like a team. We were listened to, we were not talked to. Important concept. What are the challenges of patient-reported outcome? If the questionnaire is being used, it needs to be easy to understand. One thing that I do as a patient advocate, I look at these questionnaires, I take out all the acronyms. Patients do not talk in acronyms. Patients do not understand acronyms. Every single meeting here today is going to have acronyms. Patients don't understand it. It needs to be in a language that they understand, not medical terms, but in a language that they can understand. I mentioned before, and I'll mention it again, the questionnaires cannot be too long. Patients will not complete them. It needs to be relevant to the patient and the patient needs, and it needs to be flexible on when to fill them out. If the patients come to their appointment and they're given a questionnaire to fill out, the 2.5 minutes before they see the doctor, they're not going to be complete and they're not going to be accurate. There needs to be flexibility on the format. All of you are very technology savvy, I'm sure, but please understand that not all patients are. And please understand that a lot of patients are elderly and don't have the skills or even the desire to fill something out on an iPad. Now, not all, some are very knowledgeable, but not everyone. And I know paper, nobody wants to use paper, but sometimes paper is helpful. So just keep that in mind. Patients also need to understand that the answers may improve their care. If the question is, did your doctor arrive on time? How helpful is that to the patient? Patient may be less agitated, but it doesn't have anything to do with their care. And patients need to be assured that their concerns are being heard. So if any of you are working on PROs, and if any of you are involved in developing the PROs at all, and I'm not sure if you are, but please bear in mind what I'm saying to you, that it's very important. So not only did I go to Google to get some information, and I did go to others, but I facilitate support groups. Not only am I a survivor, but I'm a psychologist and I do support groups. So I asked the ladies in my support group, it's a breast cancer group. Actually, it's all women's cancer. So I asked them if they were familiar with PROs, and they shook their heads. I asked them if they were familiar with patient-reported outcomes, and they shook their heads. They were not. I asked them if they were ever asked to fill out surveys about hospitals or doctor visits. And the answer was only if they're at a university. So I will tell you, in the oncology world, you may or may not know this, but in the oncology world, which is my world, 80% of patients are not treated at academic settings. 100% of information comes out of academic settings. So when you look at this data, you're looking at it from a very skewed perspective. So patient-reported outcomes are not part of oncology patients' most of their everyday activity. They go to their local community oncologist or their local community hospital, and they are not asked those kinds of questions. So they would like to communicate with their physicians more, and every single one of them said yes. I asked them what kind of questions they would want to be asked, and they would like to be asked, how are they managing their medications? You may or may not know also that a lot of patients are not compliant, particularly in the world of oncology. Today, there's a shift in oncology treatment from infusion to tablets. And everyone thinks how wonderful. Patients don't have to go to an infusion center. They don't have to sit there for hours. They can just take their oral medications and the outcomes are just as good. But if you're a patient and it's your granddaughter's graduation, and you know if you take this pill, you're going to be sick and you may not be able to go to that graduation, what do you think your decision is going to be? If you know you have to go to an infusion center and you're going to be there and you have to be there, you're going to be there. So oral medications are wonderful for patients that are compliant, but not all patients are compliant. Again, the session I was just in talked about hormone therapy for patients, particularly with breast cancer. The side effects are awful, just awful. And the compliance is also very awful. So managing their medications is a big deal, and patients are not asked about it. They're given the prescription, they're told how many to take, they're told when to take it, but nobody ever asks them how often they take it. They'd like to be asked if their concerns are being met. They're not. Doctors ask medical kinds of questions. but they're not asked about, are their concerns being met? They would like to be asked, are they managing their everyday activities? Do the medications cause them joint pain or pain that causes them not to be able to walk or to exercise or to be with their families? They also would like caregivers to be included in the conversation. Trust, and I tell you, when I went to those team meetings with my husband, I cannot tell you how many times the physician and the nutritionist and the pharmacist asked my husband a question and then turned to me to see what the answer was. Because my husband did not want to be a complaining patient, but I was there to tell the truth about what the experience actually was. They would like to be asked if there's anything outside of what they're seeing the physician for today that needs to be addressed. They need to be, the woman who's there for treatment needs to be asked, is there anything I need to know about your home life that is going to affect the kind of treatment that I'm going to give you or your ability to treat it, to finish the treatment? Those are important questions. And those are questions that are not asked. Again, I'm trying to plant little seeds in your heads to think about these kinds of things, because medical, electronic medical records are amazing kinds of things. We're gathering so much information. The data actually is overwhelming. We don't know what to do with all that data. But data is data is data. If it's just crappy data, I'm sorry, but it is. And I know that, and I'm also a numbers person. I'm an accountant and a psychologist. Weird, huh? But I tell you, during tax season, I do therapy with all of my accounting clients. No question about it at all. But I ask my accounting clients, I make myself, I ask about their family. I ask about those kinds of things because those are important in my accounting world, even though numbers are. And I would like you to think about how those other kinds of questions. So to fully evaluate the role of PROs, and in this case is patient-reported outcomes, in routine practice, studies need to use PROs that capture information that's important to patients and to measure the impact relative to the patient-provider relationship and the patient contributions to their well-being. Until these studies evaluate the PROs as a means to facilitate patient-centered care, their full potential in clinical practice will remain unknown. Oh, and I guess I'm finished. Thank you.